Hey everyone, welcome back to Dr. Tripathi YouTube channel.
Did you know that hepatitis, a silent killer, claims a life every 30 seconds? This alarming statistic highlights the urgent need to address this global health crisis. Hepatitis, an inflammation of the liver, often remains undiagnosed and untreated, leading to severe liver damage, cancer, and even death. This essay aims to shed light on this often overlooked disease, exploring its causes, modes of transmission, and the importance of prevention and treatment. It is crucial to understand that hepatitis is not a single disease but a group of viral infections with distinct characteristics. The most common types are hepatitis A, B, C, D, and E, each with its own mode of transmission and disease severity. While some types cause acute short-term infections, others can lead to chronic, lifelong conditions with devastating consequences. The burden of hepatitis falls disproportionately on low- and middle-income countries, particularly in Asia and Africa. However, it remains a significant public health challenge worldwide, affecting millions and straining healthcare systems. It is time to break the silence surrounding hepatitis and work towards its prevention, control, and ultimately eradication. To effectively combat hepatitis, we must first understand the enemy we are facing. Hepatitis, simply put, is an inflammation of the liver, a vital organ responsible for filtering toxins from our blood, digesting food, and fighting infections. This inflammation can be caused by various factors, including viral infections, alcohol abuse, and certain medications. However, the most common cause is viral hepatitis, which encompasses 5 main types. A, B, C, D, and E. Hepatitis A and E are typically transmitted through contaminated food and water, often linked to poor sanitation and hygiene practices. These types usually cause acute self-limiting infections, meaning they resolve on their own without long-term consequences in most cases. However, they can still be severe, particularly in individuals with underlying health conditions. Hepatitis B, C, and D, on the other hand, are primarily spread through contact with infected blood and bodily fluids. This can occur through sharing needles, unsafe medical practices, or from an infected mother to her baby during childbirth. These types are more likely to become chronic, leading to long-term liver damage, cirrhosis, liver cancer, and liver failure. Understanding the different types of hepatitis, their modes of transmission, and potential consequences is crucial for developing effective prevention and control strategies. It allows for targeted interventions such as vaccination campaigns for preventable types and behavioral interventions to reduce transmission of bloodborne types. Hepatitis viruses are stealthy adversaries, spreading through various routes depending on the type. Understanding these transmission pathways is crucial for implementing effective prevention measures. Let's delve into how each type spreads. Hepatitis A, often dubbed the traveler's disease, spreads primarily through the fecal-oral route. This means that the virus, present in the feces of an infected person, contaminates food or water, which is then ingested by a healthy individual. This can occur due to poor sanitation, inadequate hygiene practices, or consumption of contaminated shellfish harvested from polluted waters. Hepatitis E shares a similar transmission route with hepatitis A, primarily spreading through contaminated water sources. Outbreaks often occur in areas with inadequate sanitation and limited access to clean drinking water. Travelers to such regions are also at risk and should take necessary precautions. Hepatitis B, C, and D, collectively known as blood-borne hepatitis, spread through contact with infected blood and bodily fluids. Sharing needles or syringes, particularly among intravenous drug users, is a major transmission route. Unsafe medical practices such as using unsterilized needles or equipment can also transmit the virus. Additionally, hepatitis B can be passed from an infected mother to her baby during childbirth. Understanding these diverse transmission routes highlights the importance of multifaceted prevention strategies. These include promoting safe water and sanitation practices, ensuring safe injection practices in healthcare settings, and raising awareness about the risks associated with sharing needles and engaging in unprotected sex. Section 4. A Global Crisis: Hepatitis Prevalence and Impact. Hepatitis poses a significant global health burden, affecting millions worldwide. The World Health Organization estimates that over 350 million people are chronically infected with hepatitis B or C, with a staggering 1.1 million deaths annually. This makes viral hepatitis a leading cause of death, surpassing HIV/AIDS and tuberculosis. While hepatitis affects all regions of the world, its burden is disproportionately high in low- and middle-income countries, particularly in Asia and Africa. This disparity is often linked to limited access to healthcare, including vaccination, diagnosis, and treatment services. Lack of awareness about the disease, its modes of transmission, and prevention strategies also contribute to its high prevalence in these regions. The impact of hepatitis extends beyond the individual level. It places a significant strain on healthcare systems, economies, and societies as a whole. The costs associated with diagnosis, treatment, and lost productivity due to illness and premature death are substantial. Addressing the global hepatitis crisis requires a multi-pronged approach, including strengthening healthcare infrastructure, improving access to affordable diagnostics and treatments, and implementing comprehensive prevention programs. This includes promoting vaccination, ensuring safe injection practices, and raising awareness about the disease. Section 5. The body under attack: how hepatitis affects the liver. Imagine your liver, the body's tireless workhorse, under constant attack. This is the reality for millions battling hepatitis. When a hepatitis virus enters the body, it targets the liver, causing inflammation and disrupting its vital functions. This silent assault can have devastating consequences if left unchecked. In the early stages of infection, many people experience flu-like symptoms such as fatigue, loss of appetite, nausea and jaundice, a yellowing of the skin and eyes. However, some individuals may not exhibit any noticeable symptoms, unknowingly harboring the virus and potentially transmitting it to others. As the inflammation persists, it can lead to progressive liver damage, a condition known as fibrosis. Over time, the liver tissue becomes scarred and hardened, impairing its ability to function properly. This can result in cirrhosis, a late-stage liver disease characterized by extensive scarring and impaired blood flow through the liver. A damaged liver struggles to perform its vital tasks, leading to a cascade of complications. These include fluid buildup in the abdomen, known as ascites, internal bleeding, hepatic encephalopathy, a decline in brain function due to toxin buildup, and an increased risk of liver cancer. In severe cases, liver failure can occur, requiring a liver transplant for survival. Understanding the progressive nature of hepatitis and its impact on the liver is crucial. Early detection and treatment are paramount in preventing irreversible liver damage and improving long-term outcomes for those living with the virus.